Hi, Maria.
Hi.
Good to see you. Thanks for talking to us today. Hopefully, you'll be helping some other people by
Mhm.
sharing your experience. So, I know you came in with a bunch of problems
Mhm.
with your heel, actually both heels, and you were also complaining of some issues with your knees as
Mhm.
well. So, during the course of our treatment, why don't you just describe the kind of problems you had originally when you came in?
Well, both of my heels were extremely sore. I guess I had heel spurs, and then on the right hand side, which I was very impressed with the what is that thing that they call it? The
The
laser.
pharisers or the laser?
The laser.
Laser.
The laser really helped when you said the thing went over the kept going over the foot, the joint. I mean, I that was amazing to me because when I said, "Why don't you just do both feet at the same time?" When I walked out of here a few days later, it didn't
So
happen. That
we'll get to that. So
okay,
let's talk about the original pain that you had on a scale of 0 to 10. Give me a number, 10 being the worst, 0
10.
being okay. And tell me what you had done at home for that in the past, and what you had tried. Anything at all?
The
Medications? Had you
yeah,
tried?
I tried. I was on a lot of medication, and then eventually I got off everything, but nothing was helping. I was actually taking like at the time. That's a good question. Call. I was taking like 4 Advil in the morning and 3 Tylenol, and at night I would switch it to 3 Advil and then like 2 Tylenol. Just trying to make the pain go away, and it didn't go away. So then I started getting this, and I'm off medication.
And normally you're a very active person,
Yes,
correct?
very active person. Yeah.
And do you want to say what you do for a living?
Well, I'm a nanny, so I
Yes, so
chase
you
kids
chase the
around.
little ones.
Yeah,
So it's
up and
real
down, up and
important that
down.
you're healthy and you're able to do what
Mm-hmm.
you need to do at work.
Right,
And you were having difficulty doing that at times, correct?
right.
And you were having pain, swelling, and discomfort. And you came here. We've treated you in the past as
Yes.
well, but we hadn't seen you in a little
Oh,
while.
a long time,
Yeah.
long time.
And so you came back to us and tell us, what we sort of recommended to you that we try.
Well, we had the injections,
Right.
but then you said there was another method, which where you would put like the laser or whatever on, and it would make the pain go away, or pain management. That's what you said.
Right. So
So I was very open to that.
we
Yeah.
talked about trying some alternative therapies. One of which was this FDA approved Class 4 pain laser.
Mm-hmm.
And so I recommended you try one or two treatments on
Mm-hmm.
it. And so tell us about your experience with that. Did you have any pain from the laser? Is it a painful procedure at all?
Oh no, no, it's just a very warm feeling. Well, I took those two treatments like you told me, and I said let's do one on the knee, which I need knee replacements, so I'm constantly in pain in my knees, and we did it both on the right side. And when I came back, she said let's do the knee again. I said why? I said I'm totally free of pain free.
Which you
So
thought was pretty unbelievable.
yeah, I thought it was very
Yeah.
unbelievable. So then she did the heel, and then like I said, then she did the ankle, and I swear by it. That's why I got the package here, you
Right.
know. So yeah, I mean, I've been very pleased with this, and I want to do it in a way where I don't have like injections. Or I'm not on constant,
And you had
medication.
gotten injections in your knees before,
Oh yes,
Synvisc,
yes,
and cortisone.
yes.
And how do you feel this therapy compared to that in terms of relief of your pain?
Well, one, it's not invasive,
Right.
so that's always a good
So
thing,
that was great.
right? And the pain went away. Where when you get the needles and everything, that takes a long time, a couple of days for the swelling,
So it
everything
was
to go
pretty
down.
dramatic, the
Yes,
response you had.
absolutely. Especially with the knees. I mean, that was a major. And like I said, the ankle. I mean, I was totally impressed that I don't need
Laser.
another. Yeah.
Yeah, so
So.
that's been wonderful for you.
Hmm.
So, would you recommend this to
Oh,
friends?
absolutely. I already have.
That's
I
great
already
to
have.
know. And it's fabulous you can get something totally non-invasive
Hmm.
and really essentially pain-free.
Right. 10 minutes, and you can go home pain free.
And how many laser treatments have you had now? Do you know?
Um,
Four,
this will
four
be
or five?
4 or 5. Yeah. This will be probably my fifth
And
one.
on all different sites. And we haven't
All
treated
different
your
sites.
knee again after the
Nope.
initial
No,
treatments.
and we haven't treated
You
the
were on
ankle.
which
No.
has been fabulous for
Hmm.
us too as well. So, and in terms of, we didn't give you any restrictions to do anything that you couldn't do afterwards.
Oh no,
You
no.
were active right from day one after the laser
Yep.
therapy
Mhm.
as well.
Yep.
Fabulous,
Yep.
fabulous. Do you have any other things that you want to say?
I just love you.
We love you too.
Yeah, I mean, like I said, I recommended this to people. Like I said, my boyfriend said, "Can you work on my feet?" I said, "Absolutely." So,
Yeah, so it's fabulous to know that there's something out there that's
hmm
non-invasive, it's FDA approved, safe, and it's pain-free, and we can get such great results doing something
right.
like
And you said like it was a maintenance, but I don't think I'll need it much more after that. I just think it's just a great way to go.
Yeah, we have some patients with chronic arthritis that from time to time they do come in and we call them touch-up
Mm-hmm.
therapies. But you may be a patient really, and we have lots of those as well where we do, and they're great for long periods of time. So it's good to know that we're a resource here if you do need us for any sort of therapy.
Yeah, and I'll tell you, the pain in the knee, I can't describe it unless you need knee replacements, which is horrendous. I mean, absolutely horrendous. It's the grinding, it's the thing. Once she did that laser and I left, and like I said, she wanted to do it the next week. She goes, "We like to do a follow up." I said, "Why? It feels great, you know?" So
Right,
that was the most amazing part on my knee,
great.
figuring that there was joints and everything that,
Fabulous,
you know.
great. Well,
Yeah.
thanks for talking to us today. You're
Mhm.
a great patient, and it's a pleasure to share that experience.
Okay,
Okay, thanks, Marie.
thank you.
Okay.